You've probably seen it everywhere, right? Signs for dry needling at your physical therapist's office, your chiro, sports medicine clinics. It's popping up all over the place. But if you ever stop to ask a really simple question,
You'd think the answer would be straightforward, but it's not. Not at all. In fact, it's the very heart of a huge and honestly pretty heated debate that affects millions of us as patients.
So let's just cut through all the noise. We're going to break this whole thing down piece by piece so you can really understand what's at stake when it comes to your health and your care. Okay, here's our game plan. We're going to start with a totally surprising origin story. Then we'll get into the professional turf war that's going on. We'll untangle this chaotic legal map of the US and really nail down why training is so critical. And stick with me, because by the end, you're going to have the exact questions you need to ask to keep yourself safe. To really get what's happening today, we got to jump in the time machine and go back to the beginning. And here's the first twist. Dry needling has nothing to do with ancient practices. It's actually way more modern than you'd think.
So check this out. It all started with Western doctors using these big, hollow hypodermic needles for injections. But then they figured out something wild. Just the needle stick itself, with no liquid, completely dry, actually helped with the pain. But the real game changer, the moment that set the stage for all the drama today, was in the 1970s. That's when practitioners decided to swap out those thick hypodermic needles for the super thin, solid needles used in acupuncture. That one little change, well, it changed everything.
And this right here, this is the core issue in a nutshell. The goal stayed the same, get rid of muscle pain. But the tool changed. The second dry needling started using the exact same needles as acupuncture. It created this massive identity crisis that frankly has never been resolved. So that leads us to the big question, right? If it's the same tool, who gets to use it? And what kind of training do they have? This is where things get competitive. Look, this is not a simple disagreement. It's a genuine conflict between two highly respected professions. You have physical therapists saying, hey, this is a modern, science-based tool that fits perfectly with what we do. Then you have acupuncturists saying, wait a minute, that's a technique we've spent thousands of hours mastering, you just gave it a different name. And you know what? Both sides have a really valid point. So, the PTs are absolutely right when they point to its origins in Western trigger point research. But the acupuncturists are also right when they point out that the technique has evolved so much, now including things like hooking up electricity to the needles, that it's basically identical to what they call electroacupuncture. So the debate isn't just about where it came from, it's about what it has become today. And this is where the differences just become impossible to ignore. For a licensed acupuncturist, needling is the entire focus of a 3- or 4-year master's degree. For pretty much everyone else on this list, needling isn't part of their core education at all. It's a post-grad add-on, something they can pick up in courses that range from a single weekend to a few hundred hours. It really shows a totally different philosophy. For one group, it's a core competency. For the others, it's an added tool. And this chart just puts that difference in stunning perspective. You could have a practitioner cleared to stick needles in you after a 24-hour weekend course. Meanwhile, a licensed acupuncturist has to complete over 600 hours of supervised, hands-on clinical needling just to graduate. This massive gap is really the entire basis of the patient safety debate. As you can imagine, this huge fight over training has created an absolute mess when it comes to the law. We're talking about a situation where a procedure that's totally legal for a PT in one state could get them in major trouble just by crossing a state line. Right now, in most of the country, about 40 states and Washington, D.C., the physical therapy profession has successfully lobbied to get dry needling included in their scope of practice. But then you have 3 of the biggest states in the country, New York, California, and Hawaii, where the law says the exact opposite. It's crystal clear. Dry needling is the practice of acupuncture, and only licensed acupuncturists or medical doctors can do it. This creates a huge split in how patients are treated and protected across the country. And here's the kicker. Even in the states where it is legal for physical therapists, the training requirements are a total patchwork. You've got some states that demand over 175 hours, and others that have literally no state minimum at all. This chaos brings up the most important question for you, the patient. Does all this training, does it really matter? Well, when the difference between helping and harming is just a few millimeters, the answer is a resounding yes. Now, this whole debate over training hours, it's not just academic.
It has serious, real-world consequences. And in late 2024, a major injury to one of the biggest stars in the NFL put a huge, bright spotlight on exactly what is at stake.
This is a quote from NFL linebacker Patrick Queen. He said this right after his fellow player, TJ Watt, suffered a collapsed lung from a dry needling treatment. And he just nails it, doesn't he? It's a skill of tiny margins, where a mistake of just half an inch can be the difference between relief and a trip to the emergency room, especially near the chest and neck.
What happened to TJ Watt? That wasn't some freak accident. A collapsed lung is a known, though thankfully rare, risk of needling near the ribs, and it is almost always caused by a preventable error, going too deep or at the wrong angle. It's a powerful and frankly scary reminder that the risk isn't in the needle itself. The risk is determined by the amount of training and experience in the hand that's holding it.
Okay, so after all that, with all this confusing and conflicting information, how on earth are you supposed to navigate this and make sure you're getting safe care? The answer is simple. You have to become your own best advocate, and you do that by asking the right questions.
Here they are. Think of this as your personal safety checklist. And please don't ever feel awkward about asking these questions. A truly confident, qualified, and well-trained provider will be happy, eager even, to give you clear, straight answers to every single one of them. If they get defensive, if they hesitate, if they can't answer clearly, well, that tells you everything you need to know, doesn't it?
So, we've gone through the history, the professional turf war, the crazy legal map, and the very real risks. The choice of who you trust with your body is always ultimately yours. But the good news is, you can now make that choice not from a place of confusion, but from a place of confidence and clarity. You're now an informed patient.